LifeFlight is a diverse organisation and a world leader in aeromedical care, but we're best known for our iconic blue and yellow helicopters which fly across the sky each and every day. We also provide air ambulance services through 3 jets located in Brisbane, Townsville and in Singapore. We operated under the name of CareFlight for 35 years, and in July 2016 we decided it was time to change our name to LifeFlight to mark a new era and reflect what we do best, saving lives. Since 1981 we've flown over 45,000 critical care missions.
We were probably the first service in Queensland to actually go out to remote locations and retrieve patients, saving lives. You can actually see that firsthand by the early intervention of these medical teams actually made the difference. So, having that platform, the helicopter and the combination of the medical teams, being able to deliver the service which it did, it was just a great combination, and it was first of its in Queensland.
RACQ LifeFlight rescue helicopters cover 75% of the population of Queensland, and our choppers and jets operate out of 8 bases around the state and 1 overseas. We also have LifeFlight Retrieval Medicine, which is responsible for the training and supply of critical care doctors, flight nurses and paramedics.
There's a good chance that if you need rescuing anywhere in Queensland, it'll be a LifeFlight doctor that comes to get you. In order to be able to do that, we have to recruit doctors from across Australia and New Zealand and from across the rest of the world. When we do that, we identify the skills that the doctors need, but then just as importantly is that they have to be the right kind of doctor, the sort of person that fits into this environment, that can practice their highly developed skills, really in situations where there's just them and their nurse or paramedic. We do get them from all over the world, Greece, the UK, Ireland, the United States, Brazil. They come from everywhere to work for us. We're proud to be able to offer that service.
In any given shift, our doctors from LifeFlight could be involved in winching down to help and assist an injured bushwalker, through to going out to a small regional centre to pick up a child who has a medical condition. So it's all about being able to involve yourself in a diverse group of patients, whether that be on the ground, in a small hospital, and giving them really quality care. No one ever knows what day is going to be the worst day of their life. Unfortunately, LifeFlight doctors are there to go and get these patients and get them to hospitals for the care that they need.
Well, both Tamara and myself were instantly relieved when we heard the chopper, and when they were winched down to us, I felt calm considering my predicament. And even though I was in and out of consciousness, I knew that I was in safe hands. I knew that I'd be looked after well, and my partner Tamara knew that as well. So that was the start of what was to be a good recovery. Probably not a day goes by that I don't think about them, to tell you the truth. Feel thankful for them saving my life. And it was only shortly after I left hospital that my partner Tamara and I went down to the hangar and met the doctor and the crewman that were there who rescued me as well. So I had to give them my personal thanks.
I feel like as a team we go in, we impact the community in the most helpful manner that we can do, and we make sure that everything's safe and that health is promoted in the most effective manner.
The most important role of the aircrew is to safely get our medical teams to the scene of the accident or to the hospital. No 2 jobs are ever the same, whether we're responding to a primary accident on the side of the road or whether we're flying a neonatal team up to a hospital to do a retrieval of a sick baby. And I guess the challenge for us is operating in the southeast Queensland, particularly with the weather patterns down here and the thunderstorms, and I guess everything it has to throw at you, and then the reward is being able to do that job and the task and see the difference that you make to people's lives.
This is all coordinated by our LifeFlight Coordination Centre, which is responsible for tasking our crews on life-saving missions around our vast state for our helicopter crews and around the world for our jets. Every time one of our helicopters takes off on a life-saving mission, it costs LifeFlight around $12,500. While the majority of our funding, around 67%, comes from the Queensland Government, we rely heavily on sponsorship and the generous fundraising of communities and people around Queensland. Our own social enterprises provide some funding, with the remainder derived from the support of our magnificent sponsors.
After more than 2 decades of partnership between RACQ and LifeFlight, it's certainly our most important community relationship. It's our deepest and our longest, and it's one we hope goes for many, many years into the future. We've enjoyed working with the old CareFlight, and we know the new LifeFlight has even better and bigger future ahead of itself as one of Queensland's iconic organisations, a life-saving organisation, and one that we know fits very closely to the values that RACQ holds dearly.
We also have the LifeFlight Training Academy, which trains our own crews and medical staff, as well as staff from external organisations.
It provides a total training solution, including wet and dry training. So that includes everything from Hewitt, which is helicopter underwater escape training, EBS, night vision goggles, and the jewel of our crown, which is just opened in September of 2016, is the Thales AW139 full flight simulator. The benefits of the visual system and also the motion control system is that we can provide any type of scenario in a realistic environment for our pilots.
Ultimately, you know, as combined forces, we've been able to get a greater reach and been able to deliver a greater service and actually provide more life-saving missions. We remain a non-profit charity. Serving the communities and saving lives is what we've always been about.